Dr. Darby here, just sharing with you the keys to prevention and treatment of disc injuries. Right off the bat, we need to be getting adjusted. Adjustments form the foundation for spinal health and all health, because remember, our spine is protecting something important. Our nervous system, our spinal cord, all the nervous system from it, because that is how our brain coordinates and adapts and controls everything in our body. And so if we get a buckle in our spine, that's going to be creating environments for disc injuries, because that jelly in the middle is going to want to get shot out towards one side. This is going to start with a bulge. It can lead to a protrusion. If we had some trauma, now we're into herniations. So we got to be getting that good alignment to prevent all those things. On top of that, when we are having a misalignment, that nerve flow through that joint is going to be decreased. This is going to affect the muscles that control and move that joint. This is going to create an environment where the brain can't properly control and coordinate that joint through complex movements. This is going to make it more likely to be injured. And so these are all reasons why we need to be getting that adjustment, okay? Secondarily, the disc is highly avascular. So what that means is it needs movement to circulate nutrition to the joint. The blood vessels are only penetrating very shallowly from the top, bottom, and outside ring. From there, the joint needs full motion, the disc needs full motion to circulate nutrition from those blood vessels to the depths of that disc. And so if a disc isn't moving in its full range of motion, it's not going to circulate the nutrition throughout the whole joint. This is going to lead to tissue weakness within that structure, and that weakness is going to lead to breakdown over time. So again, we need that full range of motion. We need that good adjustment. So make sure you're seeing a good chiropractor. On a global level, though, we want to make sure we're training. This is going to improve our coordination, mobility, and strength of our spine and surrounding structures. And we want to be moving well. So I'm going to introduce a principle here called the first joint rule. We have two bigger structures in our body, our shoulder and primarily our hips, that are designed to withstand tremendous amounts of load. If we get into bending our spine or our smaller joints as primaries, they are going to break down over time. But if we get in the habit of bending our hips and using our shoulders as primary joint movers, that's what's going to take the load, and that's going to protect our spine, but then our smaller joints of our elbows, knees, ankles, and wrists as well too. Next, we want to train weakness. So I want you to kind of ask me specifically about these questions, because depending on what we're doing, we need to work on different things. But we don't live in a perfect world. There will be time when you have to get into not so ideal positions to pick up things or move things, whether this is at work or at home. And we can do things in a controlled manner, be at the gym or an office setting or at your home, where you can train for those weaknesses. And so that way, when you're in that environment and it's not so much controlled, you're less likely to be injured because you've already prepared for that movement. Make sense? Perfect. But again, make sure you're asking a professional about this, whether that's a trainer or myself, for specifics revolving you, because we want to do this well. Because if we don't move it well, we're most likely going to get injured. Next, core function. Your core is more than just doing crunches and planks. Your core is actually formed of your diaphragm, your pelvic floor, and then all the surrounding muscles of your abdomen and lower back. They all need to be trained in a variety of movements to protect you in a variety of positions. So again, a good trainer here is key. Ask me questions that pertain specifically to you, but we want to make sure we're training our core in an all-around fashion, not just doing a bunch of crunches or planks. Hydration. Again, very avascular, but as a fluid-filled joint, so it needs a lot of fluid. So we need to make sure we're drinking lots of water, because if we have more fluid, more hydration, we're going to more easily circulate the nutrition throughout the full joint, because we just have more fluid to do it with. And so again, making sure we're getting adequate water. That's going to be an overall health thing, but specifically for the disc, that's going to be the benefit there. Supplements. I love turmeric. It's great for overall inflammatory levels. It's great for a lot of different reasons, but as it relates to spine, reducing overall chronic inflammation is going to be helpful. Now, a side note here, we want to be careful about acute injury. We don't want to be taking a lot of anti-inflammatories or a lot of supplements to reduce acute inflammation. That is an inflammation that happens right after an injury. That is actually very key in the long-term recovery. And so if we do too many things through supplementation or kind of medication or even needle injections that reduce that inflammation, we're going to reduce our overall recovery from that injury. And so we want to be careful there and doing that under guidance, particularly under a professional who understands spine like I do. Turmeric again, chronic inflammation, good. It's good for a lot of different things. Collagen, this connective tissue of the disc and a lot of joints are primarily formed of collagen proteins. You can supplement with these from broth. It's a great source, but then also you can supplement directly with collagen proteins, so just through protein supplementation. Making sure you're getting a good source here. If you have a specific question about a product, just ask me. Joint support, chondroitin sulfate, other general joint support compounds are really good for disc as well too. Lastly, make sure we're getting adjusted. Like I said, it is the key to spinal health and all health, so make sure you're going to a good chiropractor. I'll see you in the next video.